Hello. Hi, Matt. Can you hear me?
I can, Meta. How are you?
Good, very good.
Let me get our studio ready.
You might want to leave this.
You want to sit next to me? So we look like we're in the studio in my office. Can you fit?
Thanks.
How are you going to fit?
We did last time.
All right. Here.
Right there.
Hi, Elizabeth.
Yeah, let me pick you up.
Let me stare backwards for a second.
Come on.
I'm trying. Look, I'm fat, okay? So it takes a little bit of effort to get around in there, buddy.
All righty. We're going to have to back up a little bit.
Okay. Yep.
Because we got to be together in the screen here.
I'm not. Try these things.
Can you?
Let me see what angle. Yeah, I think you had it turned a little bit last time.
All right, let's try that. All right, Meta, are you there?
Yes, ma'am. Are you ready?
You sound bad.
But you don't need to listen to me.
I can't understand a word you're saying.
I think it's not longer here.
I think it's. That's what we heard. It's too loud. Turn it down.
All right, let me try it. Okay, how's that, Meta?
Is it better now?
Yes.
Yeah, I think it's better now. Maybe I had it too loud.
Turn off your cell phone.
But as long as you have, it's fine.
Okay, but we got to hear your questions. No, we're not hearing questions.
That's going to be a different. That's going to work.
That's gonna what? Try.
I think.
I think it's.
No, it's on their end.
I think it's the signal.
Okay, so how did we do our introduction last time, remember?
So we did credentialing. No, I don't remember.
Okay.
So just the questions started.
I think we just introduced each other.
Started answering them.
I think
So
we introduced each other, I think.
last time, remember? Arnie, are you there?
So we did credentialing. No, I don't remember.
He's
I think we just introduced each other.
Started answering them.
I think
So
we introduced each other, I think.
last time, remember?
Somebody needs to mute something. So we did credentialing. No, I don't remember.
I can't hear.
We introduced each other, I think. Somebody needs to mute something. So we did credentialing. No, I don't remember.
Is there, can you guys turn the volume down on your end? Maybe that'll help.
No, they muted themselves.
Is it better now?
Yes.
Okay, so maybe it was my volume that was creating the problem. I'm sorry.
Okay. Very good. All right. So
Is Rumit joining this time to ask questions as we go?
Better now?
yes. Okay. Our questions will be, the questions will come up on the screen, I believe.
Are you gonna do it in the group chat, Rumit, or are you gonna do it out loud? Is Rumit joining this time to ask questions as we go?
Better now?
Yes. Okay. Our questions will be, the questions will come up on the screen, I believe.
Are you gonna do it in the group chat, Rumit, or are you gonna do it out loud? Is Rumit joining this time to ask questions as we go?
Better now?
Yes. Okay. Our questions will be, the questions will come up on the screen, I believe.
Are you gonna do it in the group chat, Rumit, or are you gonna do it out loud? Is Rumit joining this time to ask questions as we go?
Better now?
Yes. Okay. Our questions will be, the questions will come up on the screen, I believe.
Are you gonna do it in the group chat, Rumit, or are you gonna do it out loud? Is Rumit joining this time to ask questions as we go?
Better now?
Yes. Okay. Our questions will be, the questions will come up on the screen, I believe. I feel like I'm in the Twilight Zone.
Turned off the microphone. We can hear you. It's repeating. The volume is repeating.
It's just repeating everything.
There's a separate link for that. Why can't wait? There's a group chat on the right. Why couldn't we?
Isn't that what we did last time when I brought up, what's his name?
Send us a new link, Betta, please. Chat pane. Okay, so Arani, is it the one that's on the right? Because right now there's a thing that says group chat on the right, top right, and it says IA in the center. You know what? Where's me? What's your name? It's like really hard to get in there. Yeah, so I'm trying to get this. It's just focusing. See what it's doing? So gotta focus. Why would you have it in YouTube if you're using Google Hangouts? I know that's what we did last time, but it just doesn't make sense. And last time it was a pain because we had to go to a separate window to do that.
Are we ready to go live? Or
Yeah. Well, we need the link for the questions.
we have the questions.
No, for the questions they ask.
It's right here.
No, they said it's in YouTube.
The question from YouTube?
When Pete Ruben is listening in on the conversation, and as we chat, he's going to, as we're talking, he's going to throw in questions at the end. Okay. Resend the link. When did you send it? Because check your email real quick. They should just do it there, but it's not coming up.
Okay, now I have to join in. Elizabeth and Matt, I have sent you a link for the chat. Have
So
you got
why-
my mail on the chat?
Why is the chat in YouTube, but we're working in Google Hangouts? It's got a chat pane in the Google Hangouts section.
I see Google Hangouts is for us who are the speakers. So we can chat with each other in that group chat.
In YouTube, but we're working in Google Hangouts. It's got a chat pane in the Google Hangouts section.
I think Google Hangouts is for us who are the speakers. So we can chat with each other in that group chat. Let's stop this and restart.
Communicating with them. Sort of.
Is it fine now?
I think so. I mean, it's still delayed though. And it's repeating the video over and over again. Like you can't see anything that's actually going on right this second.
Okay.
I mean, still delayed though.
Where is the echo coming from? Can you turn off your window, close your window and restart it? I think that's the problem. There's a problem from there.
Close which window?
Your Hangouts window, can you just stop that? Close your window and join back again.
Close which window? Arnie, can you see me?
Yes, I can see you now. Perfect.
Okay.
No echo, right?
I'm sorry, no echo. Now, I'm not on YouTube.
I need to pull up the YouTube.
Yes, you don't have to be on YouTube. You just need to have the live chat window open. I'll just tell you so that you can.
Is that the window here on my right?
No, that's not the window. I am sending you the link. Oops. Yes, this is the window. You must have received the link. You just need to click on the link and open it somewhere in your computer.
It comes up as a separate
Yes.
tab. So we have to
Yes.
going back and forth between one tab to another.
Your screen is big enough. Maybe you can split that, or you can have it at the background.
What I'm having to do is just move your mouse close enough to you, so when you start talking, you can just kind of reach over and switch to the questions
All right.
at the end.
All right. All right, let's move forward then.
So
Okay.
that's your theme.
All right. So do you want to start it, or do you want me to do it? You start it, like we
Okay.
did last time. Let me know when we can go live.
You can go live right now. I think everybody's watching.
Okay, go ahead.
Good morning, ladies and gentlemen. My name is Elizabeth Collins, and I am the Credentialing and Contracting Manager here at CredAxis. This is Matt Romeo.
I am also a credentialing manager here at CredAxis, and we are here to kind of explain a lot of topics on the credentialing process. What is credentialing? Why it's important? What happens if credentialing is done wrong? How long it usually takes? And also how CredAxis can also help you in your practices in order to maximize contracting opportunities for credential.
So what is credentialing? That is a very wide array of definition. Basically, as a provider, whether or not you're a nurse practitioner or a doctor or any type of medical professional, in order to be able to see patients, to get on a contract with an insurance company, they have to credential you. It's a lot like a credential, like an application for employment. they'll go through, they'll use CAQH or one of the multiple applications that they utilize to check your background from your medical license to your DEA to make sure that you are fit to be able to see their patients and that your education and background matches what they would need. So Matt, why would that be important?
Well, credentialing is a very critical process for a practice, and very important process. Number one, it has to do with making sure that you are contracted properly and credentialed properly with the payers out there. Credentialing also is every year you have to renegotiate your current contract with the payers, or you will lose money on your reimbursements. We have physicians that have called us for help saying that they've lost millions of dollars because it's been years since they re-credentialed with payers. So also your licensing and your continuing education, if that's not kept up to date and slips through the cracks, come to find out that your license has expired and not been renewed because no one's been on top of it, you've got to stop practicing, reapply. Days go by without you able to see patients, revenue lost. Credentialing is very, very important.
So some of the other implications that you would be looking at when you're actually credentialing, you're credentialing for a particular specialty. If you're board certified in general practice, but you have decided to open a sleep medicine clinic on the side. And if your clinic and if you as an individual are not credentialed and contracted to be able to perform those services that sleep medicine or additional specialty that you're doing for free. And that is something, of course, that providers never want to happen. And normally that process, if you're looking at credentialing from the time you start and you make sure that all your paperwork is together, you're doing it according to an NCQA guideline. It typically takes anywhere from 30 to 90 days, depending on the insurance. And of course, along with that, you have to make sure that you're contracted. Now, Matt, how do we usually help with providers with credentialing?
How do we help? Well, we help, in many ways. We do all the paperwork for them. It's a very tedious process. We update their CAQH. We contact the insurance companies, and sometimes these people, not the easiest people to get a hold of, very time consuming. What do some practices have to do? Most of these practices have to hire a full-time employee to fill the gaps and making sure that all these processes get done. Full-time employee is very costly. Sometimes it's an office manager that does this work. Now, office managers are not credentialing specialists, so they don't always know the right questions to ask. Again, things fall through the cracks, not to mention an office manager's job is to manage the office and not credential, because credentialing, like I said before, is a very tedious process, takes a long time. It's not just a 60, 90, or 120 days process, a wait time until the credentialing process is complete, but it's the constant follow-up. And that's the hard part of the credentialing. How can we help you here at CredAxis? Well, we can alleviate all of those issues for you. We will do the credentialing from soup to nuts. We will, as far as payment process, we have all different kinds of packages. We can do an a la carte package based on any individual task you need done, or we can do credentialing from the beginning to the end, up to 30 carriers in your area that we can credential for you for a fixed monthly rate, which is far less than you would have to pay for a full-time employee to do the credentialing for you, or to take away the duties of your office manager in doing the credentialing process. Now, mind you, office managers, they're great office managers, but they're not specialized in credentialing. Just like your office manager may not be specialized in billing, you have to have a biller to do the billing. Credentialing is just as intricate as billing. Both of them have to do with process of getting paid for services that you're rendering.
Credentialing it's a wide array of things that you're looking at. You're looking at hospital privileges. Those applications can take up to 120 days and can take anywhere just to complete the initial process. It could be anywhere up to 5 to 10 hours just to complete the initial application. If you're looking at CLIA applications for the group, for an individual provider, there's a lot that goes into it. And from a compliance angle, if there is one thing missing in your credentialing application, it delays the process. The payers should reach out to you via email. They should give you a call, but they don't. which means it leaves the office to call multiple times to check on the status of that and not realize that it was held up over in the configurations department. So now what should have been a 60-day process is over 180 days. That's lost revenue. You need to be able to treat patients and leave the credentialing to us. Let us help you with it. Take off that burden.
Is there any questions that we could answer, anybody out there?
Difficulty there for a moment. And I do see that Meta had a question. And Miss Meta, what was your question, Miss Meta? No. The unfortunate thing is the best way to speed up your process is to do it right. If you're missing your boards, or if your documentation isn't in place, or if you've had a malpractice claim and you don't document that, then you're looking at a delay due to that. So the best way to speed up a process, because again, once we submit it, we're at the payer's mercy. They have NCQA guidelines that they have to go by. And there's a lot of checks that have to be done. It's extremely thorough. So unfortunately, there really isn't a way for you as a provider to be able to speed up an application other than to make sure it's done correctly the first time. Make sure it's on CAQH, make sure it's accessible, and provide the information that we know that they're looking for, and make sure that it's compliant for the guidelines that the payers would need. You have to refresh again. Does anyone else have any questions?
Meta, you have another question? Go ahead. So the question is, do you cater to all specialties of medicine? Okay. Pretty much everything. Orthopedics, cardiology, gastroenterology, physical therapy, speech therapy, registered dietitians, CLIA laboratory, full AHC laboratory, radiology, oncologist, pretty much dentist, everything from anything that has to do with the in the medical industry. Yes.
DME, any of the medical supply companies, yes. Every single entity that is touching a patient due to the current CMS regulations, everybody has to be credentialed, regardless of what type you are.
Any other questions? Meta's question is, who are the insurance providers and payers that you fix contracts with? What we do is we do a complete analysis of your area of where you practice, and we take all the insurance carriers that are in your local area, and those are the ones that we contract, whether it be fee for service, managed care, IPA, market fee schedule, Medicare, Medicaid. the good thing that we have, or the advantage that we have over, let's say, your office managers, or if you hire an outside employee to do it, is that we have the relationship with a lot of these credentialers or contractors that are employed with these companies. So, we've negotiated with them several times because this is what we do for a living. Therefore, we get you the best rate in your area. But the insurance companies, what we do is we take an analysis of all the carriers in your area, and those are the ones that we will pursue to contract. Now, if you're already contracted with some of them, what we'll do is we'll revisit them and renegotiate those contracts for you. Again, renegotiation should be done on an annual basis. So if you haven't renegotiated in over a year or so, we will revisit that and try to get you a better deal on your contract with your current carriers.
And regardless of what state you're with, whether or not it's Arkansas or Illinois or Alaska, we have contacts nationwide. We have worked with over 4,000 different insurance companies as far south as Florida to as far north as Alaska. So we have very, very vast experience with working with Medicare contractors, Medicaid, and pretty much any that you could possibly think of. Okay, so Ms. Mehta, she asked a question, what is a good contract percentage if negotiated well? That is a tough question to answer specifically because there are multiple types of contracts. So let's say, for instance, it's fee for service, right, Matt? So it may be a percentage of Medicare, and it depends on your background, what services you provide, where you're located, what the market's like in your area, what you're choosing to offer to patients, whether or not you're doing bundled or episodic payments, whether or not you're looking at workers' compensation. Let's say, for example, workers' compensation uses a percentage of the state workers' comp fee schedule, and that's going to be different depending on what state you're in. So we will actually sit down with you, evaluate where are you currently at, what are your goals, what are you going to be doing in the next 6 months. What can we do to help you get the best rate possible? And we will work with the insurance company to see what they offer for that market and then try to give the best rate possible.
That is correct. We are very thorough. Again, we've been doing this for many years. We've got many providers contracted with us. Our satisfaction ratio is 5 stars. We have several people here that is all we do is credentialing. So and we take our clients' contracts very serious.
Okay, and if anybody else has any questions, we can go ahead and address those also. CredAxis, so Ms. Mehta had asked how long CredAxis has been doing credentialing and contracting. So each one of us, of course, has a very unique or specialized business history that we've all had. Now, together, cumulatively, we've been in business for about 5 years. I myself are working on about 15 years. Matt, I know that you have vast experience dealing with multiple insurance as well. So together, you're looking at probably over a decade of experience between each one of our representatives, and each one of us is extremely highly trained and specialized in everything that we do.
That is correct.
Great question, Ms. Mehta. Does anybody else have a question? Ms. Mehta asked, in your opinion, what is your USP? You'll have to explain to us, Ms. Mehta, what you're looking at from a context as far as what does USP mean? So our competitors, a lot of times, are working on over, several thousand providers and contracts, and they get very bogged down in the process. They end up taking on way too much work. They don't have enough account managers who can specifically address that client's needs. If somebody needs to talk to someone directly, you have to go through multiple emails or schedule appointments. Here we assign an account manager that's specific to you. And that account manager knows from a 50-state standpoint precisely what it is that you're looking to do. They have the experience, and they actually work with you from start to finish so that they know exactly what your goals are, how you started your registration, what you're planning on doing. And most credentialing companies do not give you that one-on-one contract or account manager that knows your account very well and works with
A lot of these companies also do billing. Credentialing is not their forte, so billing is their forte. So they do the credentialing as a piggyback to billing, and that's where it kind of gets complicated because, again, they don't have specialists in credentialing. They have specialists for billing, and all they do is they just get you contracted with the payers, not necessarily getting you the best contracts with those payers. Where that is all we focus on is credentialing. We don't do billing. We don't do other services other than credentialing.
However, because a lot of our representatives each have a background, each of us has come from a similar environment. So some of us have worked with a billing company in the past, and a lot of times billing companies will not even bring a contract issue to your attention until the denials are way over a certain dollar amount. So I can tell you personally that letting a billing company do it is not always your first choice, unless that billing company has that vast experience in credentialing and maybe started out there first and then migrated and learned, additional services. Thank you guys so much. It has been a pleasure talking to you. If you would like to give us a call regarding our services, our office number here is 352-796-9994.
My number is 352-340-9008, and you can reach me at any time. That is my cell phone. A lot of our clients, they call me direct. I'll be happy to answer their questions. If I don't have a question, I don't have an answer for them right there, we get back with them either on the first business day or within that day. So we are accessible. We're not just a company that you can contact us through email only. You can call us anytime and we will keep you posted.
Thank you guys very much for your time, and you have a great afternoon. What that term is, if she made it like UPS. I was going to say we love UPS. We use them to ship out our packages.
What was
It's not
USP?
UPS, it was USP.
USP.
What was
Are you
that?
guys out there?